right, welcome back to Rohrich Knows Podcast. Let's talk about the neck neuromodulators and fillers. Some non-surgical things, okay? And the neck bands can be the bane of our existence, especially after age 40. I see patients and they have neck bands and they say, well, do I need surgery? And especially if they don't have any jowls and they just have bands, it's a no-brainer to do a neuromodulator. And they are, on the verge of being approved very soon by the FDA, but we've been doing neck bands for years and years. And the key is these are the superficial redundant muscles of the face, and they're very safe to inject. The key is staying superficial. And this just shows the platysmal muscle, which really is something that goes all the way up and wraps around the lower cheek and the lip areas. And when you go like this, you can grimace and you can see these neck bands. And these are the ones that you want to obviously inject with a neuromodulator, not the deep neck muscles. These are the muscles you don't want to inject, or you can get problems like a floppy neck or even dysphagia. So stay away from those. So this is just an example of a patient being injected with Botox, 5 units every centimeter and a half or 2, and you're using a max of about 10 units per band, and then you also do one along the mandibular border, and that really helps to soften these incredible bands, and they'll last for 3-4 months. And you really want to do the whole band all the way down, like we talked about. You want to do it all the way up and all the way down, and you want to inject it in that area. And then in this area here, we're going to also inject the horizontal one above the band, because that'll relax the platysmal muscle. And then we do what's called a Nefertiti lift, which is actually injecting, microtox below the mandibular border and then also above it. And basically what that does, it actually weakens the platysma above and below and accentuates the mandibular border. So this is really the Nefertiti. And really, this really helps us by softening those fine lines also in the neck and in the lower cheek area. And that really helps by really reshaping the jawline. And we do that bilaterally. So that's called microtox, and that really helps to shape the mandibular border above and below the platysma. And here's the outline of what I just did, just to show you the injection site for that, and then the borders. And it's really called the Nefertiti lift because of all of the incredible shaping contour that you can see by doing that. So here's a band. This is from the internet, to show you an example of a band treated with Botox. And then, of course, if you don't stay deep, if you stay superficial, you won't have any of these issues. If you go deep, you can have some of these issues. And that's why you need to find a skilled injector. And I actually do the neck as part of my full face Botox that I do every day, which is upper, lower face, the commissures, the mentalis, the platysmal bands, the Nefertiti. It's very popular. So stay superficial. Find an injector that knows the anatomy of the face and the neck, and it's very safe. Now, here's another thing that's very, it's really a challenge to do, and these are these transverse necklines. And you can't fix them. You cannot fix them with a facelift. So how do I treat them? I treat them with blended or dilute Juvederm or an HA, or you can use a blended radius as well. It's a biostimulatory agent. But I actually blend this, and then what I'll do is I'll actually inject these necklines, and they'll be like little bubbles really in the dermal area, but they're blended, either blended radius or blended HA, and it works beautifully. And then I will use microtox on top of that, and it really helps to shape it. And here she is 6 months out. She looks absolutely stunning. You can see, she's got really almost no transverse lines, and she really looks amazing. So that's really a finesse way to treat these transverse deep lines that you can't treat with a facelift. And I think this is the best way to treat it. A combination of neuromodulators with a biostimulatory agent or a blended dilute HA. So that's a very brief and rapid overview on treatment of the neck bands, the early jowls of the neck, and also those troublesome transverse lines of the lower neck. So the key is find an injector that's talented, that understands the anatomy, and that will really take great care of you and follow up on you. Okay, so know before you go. Give me your comments on thoughts. And of course, if you really have multiple neck bands and jowls, you need a facelift. That's what you need. So you need to see a board-certified plastic surgeon or a facial plastic surgeon that understands how to manage neck bands, and of course, that's with a face and a neck lift. So stay safe, stay informed. Until next time.